Artificial intelligence, or AI, is simply a tool. And like any tool, its impact depends entirely on how it's used and who is using it. In some circumstances, it can increase efficiency and productivity, but it can also cause great harm. That's why Senator Erin Maye Quade says we need AI regulations now, and she has the bipartisan bills to do it. Senator, welcome to Senate Spotlight.
Thanks so much for having me.
Absolutely. Pleasure to meet you. So this session, you have a package of bills that were just heard on AI regulation. This is a subject you brought up last session as well. Why is this topic such a focus for you?
You know, it's been a really good, interesting bipartisan space that I've been working in, and with the rapid development and consumer-facing AI being completely unregulated, I've called it a 5-alarm fire for society. We have seen harm to children, harm to adults, harm to the environment, harm to consumer prices, you know, just data surveillance. It's been pretty shocking. And hopefully we would see the federal government step in and do something about this, and we've seen a complete lack of action. And in that absence of action, we've seen states step up. And so I'm part of many, many state legislatures across the country who are acting in the absence of federal action to regulate AI and make it safer for our communities.
You mentioned harm to children, and I've heard you speak about stories of children that have been harmed by the AI chatbots, and you have a bill aimed specifically at correcting that. So take me through what you've been hearing in your bill.
So the stories are pretty shocking. There are stories of children dying by suicide, engaging in self-harm, disordered eating, harming others. And then you look at even just the adults, right? You have the same issues, although you can add in like instigating acts of terrorism. AI-induced psychosis it's not a medical term, but it is a term that is being used a lot more. And it is because chatbots are designed to be engaging and never end a conversation. And so you take a developing brain, and also, you know, a lot of chatbots are also, they're designed to not cause like friction or tension, right? That happens in every human relationship, right? You might say something and someone might make a face like, oh, that's weird. And AI chatbot is designed to be like, that's amazing, keep going. And so you take a developing brain and you never end a conversation. So you have addictive behaviors. You have something that's designed for engagement. So it's going to default to the most engaging content. And for young people, that can be explicit content. It could be boundary pushing content. And with no human to kind of, you know, help set parameters around conversation, we're just seeing incredible harm. And then the last thing I'll say is that a lot of these conversations that, you know, these chatbots that they're having with these children, if it was another adult, it would be illegal. And yet, because it's a computer, it's not. And I find that to just be pretty shocking.
You talked about relationships with friction and tension, so I want to get back to the bipartisan nature of what you're seeing around this topic. You know, even red states like Texas and Florida are on board with banning or regulating AI's use by health insurers. You know, here in the Senate, you have some new allies for some of your bills. So what is it you think about this topic that's spanning the aisle?
Yeah, I think it's because the harm knows no party. Everybody uses tech. And some of the things that might naturally separate us by party or location or age, or, you know, you name your identifying characteristic, it fades away when it's a tech company, and it fades away when it's technology. And I think that because red states, purple states, blue states are seeing children be harmed, we are seeing addictive behaviors, we're seeing disorderly behavior, you know, increase in schools. You have governors like Spencer Cox in Utah, and you have governors like Governor Healy out in Massachusetts working together on this. And so it's a really good space to be in a place where it's not like we've arrived at the same conclusion from different pathways of our politics. It's that we see the harm and agree completely and fully that this is just too harmful for children, certainly, and parts of society, and it needs to be regulated.
You've spoken about the harm also done to patients, right? Yeah. So you have a bill to ban health insurers from using AI for their review, evaluation, determination, or appeals processes. Tell me a little bit about that, and have you heard from these companies? Is there a will there to collaborate for better outcomes for everyone?
So the first thing I'll say is that the insurance industry basically exists to deny claims, right? That's why they exist. And so any technology that helps them do that faster, I'm not interested in. We already have a health insurance denial crisis in this country. I'm not trying to have technology help them make it worse. But, you know, right now in law, it says that practitioner with the same or similar medical license has to make an adverse determination or deny the claim. And what the health plans say is, oh, we always have a person do that, and so you shouldn't ban the use of AI in the other parts of reviewing a claim. But what they use AI for is to automatically sort out claims that they would have approved before. So, for example, it costs hundreds of dollars to review a claim. Let's say you had a routine blood test that maybe cost the insurance company $150. It would actually cost them $250 in person time to review that claim. They will just approve it and then go on their merry way. But instead, they have an AI machine that can say, ooh, you put the address on the address 2 line instead of the address 1 line, or you put a space after the last name and it's too long, or this health diagnosis doesn't match what this blood test could be used for, and now it's automatically denied. Even though they might send it to a provider who hits deny at the end, AI has done all the work to get it to that. And what we've seen in reporting and research is that health plans like Cigna and United Health Group have taken batch denials. So you could deny 50,000 people in 1 month. They have spent as little as 1.2 seconds on medical claims and making denials. And so it has been shown that this AI technology, when deployed through health insurance companies, is being used to deny claims at a rapid pace for literally any reason. Then that's not how we want health insurance to work.
Keeping with affordability, you have another bill on that topic relating to AI. That's Senate File 3098, which would prohibit the use of artificial intelligence to dynamically set product prices. So tell me about the need for that kind of legislation.
So surveillance pricing is actually one of the reasons that we are seeing higher costs. It makes it incredibly difficult to comparison shop, because what companies do is they take all of the data that they have about you and then they set a personal price. So you and I could order from the same Target, the same gallon of milk for the same pickup time on the same day, but they would charge me more because they think they can get me to pay 20 cents more than they could get you to pay. And that is what surveillance pricing is. It is an individual price set to basically squeeze every last cent out of American consumers that they possibly can. And so Senate File 3098 would just simply say you can't set individual prices based on all this individual surveillance data that you gobbled up. Do you want to give discounts to loyal customers? By all means, go ahead. Do you want to give discounts to specified groups, veterans, teachers, students? Absolutely, go ahead. But how can you comparison shop between a Target and a Cub Foods if what you're getting charged at Target and Cub Foods is individual only to you and not to the price that the product actually is? And so that is what surveillance pricing is, and that's what my bill seeks to ban.
Yeah, and that sounds different from what people think of when they normally hear dynamic pricing, because there are arguments that dynamic pricing can put more products in reach for certain customers because the price is not set. So if the price is lower, they might have more access, right? But this is not that.
Correct. This is not that. This is trying to maximize the most money that you can get out of a person. And part of the social contract, right, is that there is a price point for a thing, and there are some prices that you might get at different locations, right? If it's a farther drive or a closer drive, depending on where you're at or the population that lives here, like those things actually impact prices by region, location, population. But this is saying, no, Erin Maye Quade, you have a different price for rice than your next door neighbor does from the same store at the same place at the same time on the same day.
Yeah, that's wild. I haven't heard about that.
It's terrible. And they've done studies and they used Minnesota as a test case. And so Minnesota stores have already been found to be doing this.
Wow. Well, thank you for bringing attention to that. Yeah. Your final bill in the package is Senate File 1886, which would require notification if people are interacting with AI. Tell me, why is that necessary? Because I'll see a little pop-up, on a window and it says, "Can we help you?" And I'm like, oh, that must definitely be AI, right? Yeah.
I think the one that people don't realize is that a lot of the places you're calling to set up appointments are also AI. So this could be really important from the low stakes thing, like I need to return something, or I have a question about my product, to really high stakes, like I need to make an appointment for an urgent cancer treatment. And if you're talking to an AI agent and for whatever reason the AI agent just doesn't understand what you're asking, right? Like, I have this pair of jeans from this store, I'd like to return them, but I got them 3 months ago. Can I still return it? If it doesn't understand that question or that prompt, how are you to engage with the company to return your jeans? But on the more serious side, if you're calling and the AI agent picks up, you're making a cancer treatment appointment, and you're saying, I want to switch my appointment to a clinic that's farther away from where I live, but it's closer to where I work, so can I come to the Blaine location? If it doesn't understand that or makes the appointment at the wrong location, you could miss out on treatment. And so this just requires my bill to inform people that they're interacting with AI, and then have an option to talk to a human at some point. It doesn't require that you immediately get turned over to a human, whether that's email or in person or a phone call or a text or whatever they might come up with in the future, but that talking to an actual human is part of the process because we deserve to have that human interaction as the course of business.
I have been stuck in that loop before where it's like press 6, and then you press 6, then you get back to the original menu, and then you have to press 6 again, and it's just never ending. So yeah, definitely an opportunity to talk to an operator would be very helpful.
Always,
there.
yes.
Let's go bigger picture, and you mentioned this in the beginning of the interview, but the federal government has said it should be the one to set AI regulations. So why do we need to get involved in that?
Well, the government hasn't set any AI regulations, and we are many years into this consumer-facing AI with zero regulations and lots of documented harm, and it's increasing. And I think this federal government in particular is in bed with these AI and tech companies. I mean, you watched those tech CEOs sit behind the president at the inauguration, and so I'm worried that industry has successfully lobbied and bought off pretty much any person that they would stand in their way. And in fact, we've seen that these tech companies have started at least 3 different PACs to challenge state-level legislators like myself, whether they're Republican or Democrats, right? They're just looking, are you getting in the way of us having unfettered access to your data and rolling out consumer-facing AI with no consequences? And so, the federal government has not acted. I would love it if it did, but we have so many strong consumer protections that exist in the physical world, and we have none in the digital world. And if the federal government isn't going to make any, states will.
You mentioned, there are already challenges at the state level. So if Minnesota moves forward, are we opening ourselves up to any costly court challenges?
We could be, but we wouldn't be alone. We would be in really great company. And at a certain point, you get so many states to pass same or similar laws, and you have effectively created a national regulation. And so a lot of us who are working on this space as state legislators work across both the political spectrum and the geographic distance of our country, because our goal is to essentially create what would be a national framework. We'll just do it state by state.
Okay, grassroots national framework. Okay, Senator, thank you so much for your time.
Thanks. It's great to be here.